Howdy, future nurses. Welcome. We're going to have 20 NCLEX practice questions. They are all medical, surgical, nursing, and I'm going to be providing the rationale to the correct and incorrect answers. So, are you guys ready? Let's start with question number 1. A patient receiving heparin has a PTT greater than 100 seconds. The nurse prepares to take which action? So I'm going to give you a 10-second counter, timer. So, okay, I'm going to reveal the correct answer. The correct answer is letter C. So a PTT of greater than 100 seconds signals excess anticoagulation. So holding the heparin prevents bleeding while awaiting for provider guidance. Letter A is incorrect because continuing the rate increases bleeding risk when the PTT is already high. Letter B is also incorrect because increasing the rate worsens the excessive anticoagulation. And letter D is also incorrect because flushing does not really address the dangerous elevated PTT. Let's go to question number 2. A patient with COPD reports dyspnea after activity. Which findings suggest chronic CO2 retention? Here's your 10 seconds timer. Okay, so the correct answer is letter C. A viral chest forms from long-term air trapping and hyperinflation, consistent with CO2 chronic retention. Letter A is incorrect because confusion can occur with hypoxia, but is not specific for chronic CO2 retention. Letter B is also incorrect because flushed skin may occur in other conditions and it is not tied to chronic retention, whereas letter D is also incorrect because rapid normalization of oxygen saturation does not really reflect CO2 status. Let's go to question number 3. A patient with heart failure shows new crackles and increasing shortness of breath. Which action supports improved oxygenation? So, okay, the correct answer for question number 3 is letter B. Upright positioning reduces preload and promotes lung expansion, which supports oxygenation. Letter A is incorrect because extra fluid may worsen fluid overload. C is also incorrect because lowering the head of the bed impairs breathing. And D is also definitely incorrect because more sodium increases fluid retention. Let's go to question number 5. A patient with DKA receives IV insulin. Which lab result shows therapy is effective? Okay, so the correct answer is letter C. A pH moving toward normal signals improve metabolic acidosis in DKA management. A is incorrect because a potassium level of 6.0 remains high and signals ongoing imbalance. B is incorrect because blood glucose of 480 shows poor control despite insulin. And D is also incorrect because persistent ketones signal continued ketosis. Remember, the patient has DKA. So let's go to question number 5. A patient with ischemic stroke suddenly shows new right arm weakness. The nurse anticipates which diagnostic step? 10-second counter timer is on. Okay, so question number 5, the correct answer is letter B. A non-contrast CT rapidly identifies bleeding and directs early stroke management. A is incorrect because coagulation tests do not really confirm stroke type quickly. C is incorrect because urinalysis has no role in acute neurologic decline. And letter D is also incorrect because BNP evaluates heart failure, not neurologic changes. So how's everybody doing? Okay, so before we go with question number 6, if you're able, follow or subscribe to this channel because I'm gonna be doing Q&A daily starting today. Okay, so let's go to question number 6. A client receiving furosemide reports muscle weakness. Which assessment best supports suspected electrolyte loss? 10-second timer. Okay, so the correct answer is letter A. So furosemide increases potassium loss. Loss of potassium can produce irregular rhythms. B is incorrect because cool skin does not really reflect potassium status. C is incorrect because bowel sounds may slow for many reasons are not really specific for potassium loss. And D is incorrect because pupillary constriction does not really relate to electrolyte imbalance. Let's go to question number 7. A post-operative client reports sudden shortness of breath. The nurse notes tachycardia and low oxygen saturation. Which action supports oxygenation? Okay, let's have that timer. Okay, so the correct answer for question 7 is letter B. Oxygen improves delivery during acute respiratory compromise. Letter A is incorrect because supine positioning can worsen ventilation. C is incorrect because fluid restriction does not address respiratory compromise. Or letter D is also incorrect because lowering the bed reduces lung expansion. Let's go to question number 8. A client takes lisinopril for hypertension. Which finding requires follow-up? Okay, so the correct answer for question number 8 is letter A. A dry cough may occur with ACE inhibitors and may require a change in therapy. B. Appetite changes are not linked to lisinopril. C is incorrect because warm hands carry no link to ACE inhibitors' effects. Letter D. Stable weight does not really signal medication issue. Let's go to question number 9. A client with hypoglycemia receives IV dextrose. Which finding shows improvement? 10-second timer. Okay, so correct answer for question number 9 is letter B. Clear, steady speech signals improve glucose delivery to the brain. Letter A is incorrect because tremor can persist in low glucose states and indicate limited improvement. C is incorrect because cool, moist skin reflects adrenergic activity and may continue during hypoglycemia. And letter D is also incorrect because confusion indicates continued loss or low glucose effect. Let's go to question number 10. A patient with pneumonia receives IV antibiotics. Which data shows treatment progression? So the correct answer for question number 10 is letter C. A falling temperature indicates improving infection control. Letter A is incorrect because rapid breathing and accessory muscle use signal worsening work of breathing. B is also incorrect because worsening crackles show poor air movement and persistent consolidation. D is also incorrect because new thick sputum suggests ongoing infection. So we're finished halfway. How's everybody doing? If you're able to, write in the comment section where you guys watching this video. Okay? So let's go to question number 11. A client with ulcerative colitis reports 6 loose stools today. Which assessment best indicates worsening dehydration? The correct answer is letter C. So dry oral mucosa is a reliable indicator of fluid loss with increased stools. A is an incorrect option because fast capillary refill suggests adequate perfusion. B is also incorrect because stable blood pressure does not really reflect worsening dehydration. And letter D is incorrect because warm, dry skin is very non-specific. Let's go to question number 12. A client receiving morphine becomes difficult to arouse. Which finding supports opioid-related respiratory depression? So the correct answer is letter A. A low respiratory rate indicates opioid-induced respiratory depression. B is incorrect because heart rate alone does not really confirm respiratory depression. C is also incorrect because warm extremities are not connected to opioid toxicity. And D is also incorrect because bowel sounds do not really assess respiratory status. Question number 13. A client with SIADH has a sodium level of 123. Which symptom warrants immediate attention? So the correct answer is letter A. Headache may signal worsening cerebral edema with severe hyponatremia. B is incorrect because dry skin is not really typical of SIADH. C is also incorrect because urine odor does not really indicate severity. Or letter D is also incorrect because bowel changes do not really reflect sodium status. So let's go to question number 14. Question number 14. There you go. A client with new onset atrial fibrillation reports palpitation. Which assessment is most important? Okay, so the correct answer is letter B. Blood pressure helps determine stability during atrial fibrillation. A is incorrect because capillary refill doesn't really guide atrial fibrillation management. C is also incorrect because bowel sounds are unrelated. D is also incorrect because pupillary response does not assess hemodynamics. Let's go to question number 15. A client with asthma shows increased wheezing after using a rescue inhaler. Which assessment is most concerning? Okay, so the correct answer for 15 is letter A. Difficulty speaking signals worsening airway obstruction. B is incorrect because hand temperature does not evaluate airway status. C is incorrect because abdominal findings are not relevant. And D is also incorrect because thirst does not reflect respiratory decline. So we're question number 15. How's everybody doing right now? Are you still with me? Okay. Now, if you're able to also let me know in the comments section what topic you want me to cover or question and answer you want me to cover. So let's go to question number 16, okay? And we have 5 more and we are done. So question number 16. A client with heart failure has a new 2 plus leg edema. Which finding best supports fluid retention? Okay, so the correct answer is letter A. Rapid weight gain indicates acute fluid retention in heart failure. B is incorrect because clear lung sounds do not confirm worsening volume status. C is incorrect because mucosa color is unrelated, really. And D is also incorrect because skin warmth does not assess fluid status. Question number 17. A client with hyperthyroidism reports heat intolerance. Which additional finding supports the diagnosis? Okay, so the correct answer is letter A. Increased heart rate aligns with increased metabolic activity. Hyperthyroidism, right? B is incorrect because slow speech reflects hypothyroidism. C is also incorrect because weight gain contradicts with hyperthyroidism. And letter D is incorrect because cold skin matches decreased metabolism. So let's go to question. The next question is 18. Okay. A client with burn injury has urine output of 15 ml per hour. Which action supports renal perfusion? So look at that timer in. Okay, A is the correct answer in this question. Low urine output reflects inadequate perfusion. Fluids help restore it, right? B is incorrect because sodium restriction does not really restore perfusion. C is also incorrect because position changes do not correct hypovolemia. And D is also incorrect because holding oral intake does not really improve output. Let's go to question number 19. So a client with chronic kidney disease reports muscle cramping. Which findings support suspected electrolyte imbalances? Let's get you the 10-second timer for question number 19. A is the correct answer. High potassium can produce muscle symptoms and is common in kidney disease. B is incorrect because normal glucose does not explain cramping. C is also incorrect because normal calcium does not support the symptom. D is also incorrect because normal hemoglobin does not really indicate an imbalance. Let's go to our last question. A client with sepsis receives IV fluids. Which finding shows improved perfusion? There you go. So the correct answer for question 20 is letter A. Normal capillary refill suggests improved blood flow after fluids. B is also incorrect because rising lactate indicates worsening perfusion. C is incorrect because increased oxygen need signals deterioration. And D is incorrect because cool mottled skin reflects poor perfusion. So how did you guys do? If you're able to comment your score in the comment section, do so. Thank you for watching. Like I said, this is my first few TikToks. I'm sorry, YouTubes here for YouTube channel. Okay? Thank you for watching. You guys have a good day.